Peripheral arterial disease, or PAD, is a condition whereby the arteries that supply the legs are narrowed and diseased, such that blood flow is then impeded. Blood flow to the legs then become weaker and slower, and as a result, patients develop problems. Patients with diabetes mellitus, especially long-standing, poorly controlled diabetes, are at very significant risk of developing PAD. In addition, patients with a history of heavy smoking, heart disease, and high cholesterol are also at risk of developing PAD. It usually starts off as developing heaviness and tiredness with pain in their legs, specifically in the foot, calf, or thigh, and this occurs after the patient attempts to walk a certain distance. If the arteries become narrow and narrow and blood flow becomes more and more limited down the legs, patients can then progress from having cramps on walking to even just having severe pain even while sitting down or asleep at night, because data shows that if you leave them untreated, especially those with tissue loss, they eventually will progress to a major limb amputation because of infection and tissue loss, and there would be an amputation below knee or above knee. A simple visit to a vascular surgeon would do. We examine the pulses in the legs, we feel for good blood flow. Sometimes we use a Doppler or ultrasound, and what we do is we look at the state of the blood flow as well as the state of the arteries. A simple treatment could involve starting different kinds of medication, one of which is blood thinning or antiplatelet medication. This will help thin the blood and still maintain blood flow through the narrowed and diseased artery. If, however, the patient has severe pain, is unable to walk, or has already developed tissue loss such as ulcers and gangrene, then the treatment takes a different angle. It means improving the blood flow down the legs. Nowadays, we do a procedure called angioplasty and stenting. This is where we make a puncture in the leg arteries, and under X-ray guidance, we pass a wire across the blockage and then use a balloon to widen the artery to improve flow. Sometimes we may deploy what we call a stent. A stent is a metal framework or lattice that is deployed in the artery to keep it open and widen for long periods of time. That usually improves blood flow down the legs, relieves the pain, and if there's tissue loss, allows for wound healing, meaning the ulcers will heal and the gangrene or toes will improve. In some patients in which the angioplasty and stenting are not suitable or are not successful, we then do a surgery called a bypass. A bypass is in which we take a vein from the patient's legs and we connect it to the artery above and below the blockage to improve flow. So therefore, if you think that you have peripheral artery disease, or if you have risk factors for peripheral artery disease and are experiencing pain, please feel free to come and see us at the Vascular Interventional Center so that we can help you.